Well, I'm a native Mississippian, so I'm a product of the public schools in Mississippi, and I was fortunate enough to train here at University of Mississippi in OBGYN. Urogynecology, reconstructive pelvic surgery fellowships were pretty rare when I finished training, but there were maybe 10 or 12 in the United States, and I was very fortunate to get one at Duke University, which I think at that time was really one of the most premier training programs. And while I was there, I really immersed myself in it. I loved it. And so I think I've ended up doing what I was probably supposed to do in life. Our philosophy for patient care at Southeast Urogynecology is really listen to the patient and then do what's best for the patient. And again, most of the things we deal with are quality of life issues, so they're very personal for these women. They're things that specifically affect things at home, or they can't do certain things socially that they used to do. So the patients are coming to us saying, look, I'm not really hurting and I'm not really dying here, but I'm just sick of this. Is there any way that you can help me with this? Most of our patients actually will come in after quite a while of dealing with things. And the main things that we care for are urinary incontinence, inability to control your bladder, some bowel incontinence, and then pelvic support issues where their vagina just actually loses support, sometimes comes all the way out. So they'll feel bulges and pressure. So really the incontinence part is probably a significant quality of life issue that technology has allowed us now to really assess and treat in a very minimally invasive way. So these patients come in, will have something done, and get out of there and back to their normal lives literally within a week. Well, I think what many of my patients may not get from me is that behind what I think is a very patient and compassionate moments with the patient, those times I have with them, is that behind that there's a lot of motivation and a lot of really intense desire and work ethic and trying to be better and do the best that we can do in lots of things, not just medicine. And my partner and I both are that way. And so we want to be the best and do the best and take care of the patients and be with their families and just make it a good experience the best that we can.